An ounce of prevention is worth a pound of cure. More than 1,000 people are rushed to the health emergency department to get treated for overdose each day. Out of those 1,000 patients, 91 patients die from overdose. According to the Center of Disease and Control, drug overdose deaths have only continued to increase in the United States. Painkillers and antidepressants have become one of the top leading prescription drug abuse, making it one of the top healthcare concerns. People are misusing the prescription drug, and it's costing the healthcare system billions. Whether they're taking more than prescribed or using someone else's prescription to get high, all of this results in overdosing. Oftentimes, people are misinformed about the risks that the drug may come with, such as how addictive the drug can be. Other times, people will make their own assumptions that a prescription drug is not as dangerous as a street drug. The Center of Disease Control and Prevention has stated that receiving a prescription drug for a painkiller and antidepressant is very easy. The National Institute of Drug Abuse states that young adults between the age of 18 and 25 take prescription drugs to get high, while older adults more than 50% of older adults are, while older adults between the age of 57 to 85 are using a prescription drug. They have reported that more than 50% of the older adults are dosing more than 5 medications or supplements daily. Taking more than 5 supplements of medication daily can lead to health problems in the long run. And some of the health problems that can be caused in the long run are liver complications. Writing someone a prescription for a drug is not always the most effective and safest form of treatment. Cognitive behavioral therapy is a psychotherapy where the patient strives to recognize and change their negative perspective of the world and oneself. It hopes to alter their negative and unwanted behavior. This eventually will help them have control over their disorder. Cognitive behavior has shown to be effective in a broad range of disorders in both children and adults. Unlike prescription drugs, cognitive behavior therapy works without causing side effects and strives to cure the disorder and not just the symptoms. CBT, which is another form to say cognitive behavioral therapy, teaches the patients things on how to reduce the risk of the disorder coming back in the future. Applying cognitive behavioral therapy as a solution in treating patients with disorder will not only benefit the patient but the future of our healthcare system. Since CBT works without causing side effects, future health complications, and teaches the patients to reduce the disorder from coming back, it will save our healthcare system millions of dollars. The National Institute of Drug Abuse has stated that prescription drugs are costly to our nation, approximately $26 billion, and it's only expected to increase over the years. People will only continue to get hooked on the prescription drug and continue to rely on how to get rid of the symptoms. As for cognitive behavioral, people will require fewer sessions in the future and maybe, hopefully, no sessions at all. Prescription drug overdose has become one of the top healthcare concerns. Thousands of people are rushed to the ER because of a prescription drug misuse. While hundreds of those people do come out alive, around 91 people per day die because of an overdose. In order to prevent future prescription drug overdose, it's important to think of potential solutions to the problem. A solution to this problem is to reduce the number of drugs being prescribed to patients. While the use of drugs are helpful, there are needs and needed for some patients, it's not always the most effective and cost-effective prescription. Thank you.